Okay. Well, hello everybody, and hopefully everything will go really well. This is the first time I've done the Facebook Friday, and it's the 20th of August at 1 p.m. So first of all, I'd just like to acknowledge country. So I begin today by acknowledging the traditional custodians of the land on which we meet today. And that's the Gadigal of the Eora Nation, which is in Sydney, and pay my respects to elders past, present and emerging. I extend the respect to Aboriginal and Torres Strait Islander peoples here today. And very happily, we've got Helena Rodi here with us. And Helena is the National Manager of Education with Advanced Care Planning Australia. She has over 12 years experience as a healthcare clinician, and is committed to delivering high quality healthcare education and curriculum. With a background in acute care and cancer services, Helena contributes valuable insights into the patient experience and is a champion of patient-centred care. She recently worked on a grant with Cancer Australia and published work on exploring the knowledge, attitude and experiences of people with cancer, their families and health professionals on advanced care planning. Helena balances her work with the Advanced Care Planning Australia with her role at Deakin University as a lecturer, and most important role is as a mum of two girls who we've just been having a chat about. And with COVID and sorry.
We have.
With COVID and the lockdown, the kids haven't been able to go to the park and play, so it's been a little bit hard. So I'll let Helena get started, but just thought I'd start it off by just asking, what is advanced care planning?
Perfect. Thank you for that lovely introduction, and it's just a pleasure to be here today and be able to speak to all of you. So just to give you a bit of a background, advanced care planning is a process that can help you plan for your future health and personal care. Your values and preferences are made known so that they can guide decision making at a future time when you might not be able to make or communicate your decisions. So for people with cancer, it gives you a voice and allows you to receive the treatment and the care that you want when you might not be able to make or communicate decisions. So put very simply, advanced care planning is about answering these three questions. If you're unwell and you're unable to make your own medical treatment decisions, who would you want to speak for you? What would you want them to say? And do they know what you want them to say?
Oh, I've lost you.
Can you still hear me?
I can hear you now. I lost you for a moment.
Oh, great. Back on.
Back on? Yep, I can hear you.
So we can also talk about some of the benefits of advanced care planning, and really everyone can benefit from advanced care planning at different stages of their lives. Advanced care planning has benefits for people with cancer, but not just for yourself, but for your family, your loved ones, for health professionals and services. So for people with cancer, it allows you to state your preferences and put your plans into place, meaning that you'll be more likely to receive the treatment you prefer. These discussions may help you know that your choices will be respected as well, and could also potentially avoid treatment that you wouldn't want to receive. I think also for people with cancer and for all of us, we really concentrate on our family and our loved ones. And so knowing that advanced care planning can help your family and your loved ones feel more confident in making decisions for you, as well as reduce the burden on them to make these decisions if you do lose capacity. It can also reduce worry for family and loved ones, and it improves satisfaction with the care you receive. It also helps to minimise the need for them to make difficult decisions under stressful situations. We know that it's really hard when you are in hospital or where there's a stressful situation to make a decision. So to take that burden and minimise the stress because your family already knows what you want is a really big bonus for them. It also helps to avoid conflict between your family and your loved ones, as they already know what you want. So working in an oncology ward for over 12 years, I've unfortunately seen too many times when families disagree about what the right decision for the patient is. Being in hospital is a stressful time for you, but also for your loved ones. So participating in advanced care planning can help alleviate some of the burden of decision making and reduce the potential conflict. It's very helpful for you and for your loved ones, but it's also very helpful for your treating team.
So, Helena, are there any other benefits for the healthcare professionals and the services?
Yeah, that's a great question. So for health professionals and for services, advanced care planning helps to support patient-centred care. We always want to make sure that the care we provide for you, for all of our patients, is what they want to receive. And advanced care planning really allows us to do that. It also makes it very clear who the contact person is and who to contact to speak on behalf of you if you weren't able to make those decisions. So who would we call in the middle of the night if there was a decision to be made? It's also, as a health professional, we, as you know, place a lot of value on care, and we want to provide you with the care that you want. So advanced care planning really enables us to know, respect, and follow your preferences when we're making medical treatment decisions. And it can also reduce unnecessary or unwanted hospitalizations. We know that hospital isn't the place you want to be all the time. So if there's a way we can avoid it and we can give you what you want, we'd really like to be able to do that.
That's lovely. And why should people with cancer participate in advanced care planning?
So advanced care planning, as I mentioned earlier, is important for everyone, but it's also really important for people with cancer, and probably more important for people with cancer. It's an important element of consent. We need to know what your preferences are. And ideally, advanced care planning conversations should start early and while you can still make decisions. There are often cases when some of our patients have become unwell with an infection, they're delirious, they're unable to make their own decisions. During this time, if they had an advanced care directive, their treating team would be clear on what treatment they would or wouldn't want to have. When they improve again and they become well, they're then able to go back to making their own decisions again. It can be hard and challenging thinking about a time when you don't have capacity. And participating in advanced care planning doesn't mean that you're giving up. And I often tell my patients with cancer that advanced care planning is like having car insurance. We purchase car insurance hoping that we don't have a car accident, but knowing that if we do, we have a backup plan. We all hope that we will be able to make our own decisions and about medical treatment and the care we want to have. However, we know that more than 50% of us won't be able to.
So how can our listeners or the people that we've got here with our Facebook Friday get started with their advanced care planning?
I think the first step is thinking about who would speak for you and going back to those 3 questions that I asked. So the first step is really thinking, who would you want to speak for you and what would you want them to say? So the national term for the person who can speak for you or speak on your behalf once you lack capacity or if you don't in that moment in time is a substitute decision maker. Each state and territory around Australia has a different name of what they call this person, just to keep us on our toes and confuse us. But the national term is a substitute decision maker. So think about and decide who you'd like to speak for you if you're not able to speak for yourself. Sometimes people assume that they'll be your substitute decision maker, and they might not be the best person for you. They might not be able to handle stress well. They might feel uncomfortable making big decisions or significant decisions. They might not feel confident in having discussions with medical staff, and that's quite common. After giving a presentation once, a lady approached me and said, "I've realised I've appointed the wrong person. I've appointed my husband to make decisions for me, but he hates being in hospitals. He becomes very anxious in stressful situations. And really, I don't think he'd cope with being able to make decisions. So she said, I've decided to go home and appoint my youngest daughter instead. She's always calm under pressure and she'll be able to follow my wishes. So thinking really about what the role of that person is going to be and who the right person is for you and in your family or loved ones to be able to make those decisions. So also when you're thinking about it and deciding who this person should be, also consider that it's somebody that you need to trust. They also need to be accessible. So do they live in the same city or region? And they need to be over the age of 18. As I said, it's also really great if they can be calm and logical under stress. And more importantly, do they know your preferences and what's important for you? You're asking somebody to speak on your behalf. And so they need to know what it is that you'd like them to say. So if you have thought of someone you'd like, ask them if they're willing to act in this role for you. They need to agree and then talk to them about your preferences. A good way to start the conversation might be, I've been thinking a lot lately about what matters most to me in life, because we know it can be hard to start these conversations with family and loved ones, and it can be a bit of a challenge and a bit of an uncomfortable topic. So raising it really gently about, I've been thinking about what matters most in life to me, can be a really good place to start. And it's very important that your substitute decision maker knows your values and preferences and is also willing to enact them for you. In my work with a young adult with cancer, he had appointed his mum to be his substitute decision maker. And when he spoke to her about it and his values, she very wisely actually said to him, I'm your mum and I know I want to keep you around for as long as possible and I won't be able to let you go. So I think it's best you ask someone else. And so he then asked a close friend who was able to take on the role and could actually enact what he wanted.
I think that's very important advice there, especially sort of when it's somebody that's so loved, and whether the decisions are going to be sort of great benefit and helpful, because it's very hard when you're very close to somebody. So if anybody wants to ask any questions at all, just please type them in because I can see them, so we can ask them to Helena as we go through. So if you do appoint someone, does that mean that they can then make treatment decisions for you?
Yeah, that's a great question. And often people do feel concerned about appointing someone because they feel that they'll lose their ability to make decisions. But it's really important to know that a substitute decision maker, or when you appoint someone, it only takes effect when and if you lose the ability to make or communicate decisions for yourself. You'll continue to make your own decisions for as long as you can. And actually, we want you to be involved in your decision making for as long as possible and as much as you can. So even if you have even if you've lost a little bit of capacity, we'll always try and involve you and try to get you to make decisions if that's possible. But if you lose decision making capacity, they can then consent. They can refuse, or they can withdraw from treatment on your behalf. And it's important to remember that their role is to make the decisions that you would have made for yourself. So we've moved away from making the best decisions for you, and now it's about making substituted decisions, or the decisions that you would have made for yourself. So often some of the questions that I might ask someone if they're making decisions for someone else is, what do you think the person would do if they could speak for themselves now? Or what do you think they'd say if they were here? Just to encourage that person to think about what it is that you would want to happen, not what maybe is best for them.
So, I mean, just sort of talking about that, where if somebody loses the capacity, does it sort of come in where there's like the power of attorney or any sort of legal things with that, or administration that you have to go through courts? I know it's supposed to be getting a little bit complex, but just wondering.
Yeah, so it's really important to know that you can appoint someone that it is quite separate from power of attorney, and that was sort of some of the old terminology, especially with medical treatment decisions. So it's different to your finances and making those sort of decisions, but you can appoint someone without seeing a lawyer to make these decisions on your behalf, and that just relates to medical treatment. So you don't have to go through the power of attorney process, and that's more of a legal process. This is more at the time, if you lose capacity, we go to this person to make the treatment decisions for you, and it just relates to medical treatment. So if you appoint someone, it doesn't mean that then they can make decisions about your finances and other aspects of your care.
Mm-hmm. I've got a couple of questions that have just come through. One is, do you have advanced care plan templates that you recommend? Oops, and I've just lost part of it. Here we go. And do you have examples of completed advanced care plans to see how others have approached it?
Yes, that's a great question. So I'm going to guide you to our website later, but it's advancedcareplanning.org.au. And actually every state and territory around Australia has got their own template for advanced care directives. And I'll go through what is in all of those templates and how you might start to fill them out and what questions are in there. But that gives you a really clear guide about what needs to be included, and make sure that you've got, simple things like your name and your date on all the pages, that it's signed and witnessed, so that it actually does stand up, and so that as a health professional, we know that that's a legal document and that it's actually written by you. So there are templates and they're available for every state and territory. So again, they're available on our website, advancedcareplanning.org.au. Now, with having some examples, it's actually really hard to provide examples because everybody has different things that they value and everybody has different things that's important to them. And we also want to make sure that it's really about you and what you want. But we do have a national support service. And we've got a phone number that you can call, and we can guide you through the whole process. We can help you turn your thoughts into words and put them on paper and support you through that whole process. So if you are struggling and you do need some help with the forms or thinking about what you might write in certain sections, a really wonderful team can support you with thinking about what your values are and getting them down on paper. So the number for our National Support Service, it's free to call from anywhere in Australia. And the number is 1300 208 582. And I'll continue to repeat that number throughout the presentation. We'll put it up at the end as well, in case I'm speaking a bit too quickly.
No, you're not speaking too quickly. Oh, sorry. My sound was not very good then. We've got another question. Who do you notify of your person you have chosen?
Could you repeat that question? Sorry. Who do you notify?
Who do you notify of your person you have chosen?
Oh, great. Great question. So once you've picked the person, you do fill out these forms, the Advanced Care Directive, and they're the same forms that I mentioned earlier. And there's different forms for every state and territory. So again, you can find them at advancedcareplanning.org.au for the particular ones in whatever state you are. And then once you've completed that form, we encourage you to share it. So give a copy to the person you've appointed, share it with your health professionals, upload it onto My Health Record so that it's available wherever you might go in your treatment pathway, so that all of those services can have access to that information. But if you do have hospitals or services that you access all the time or that are local, you can send them a copy or give them a copy at your next appointment as well, so that they've all got a copy of that same document. But there's no point leaving these documents locked up at home. The more you share them, it means that people know that they're there and can reach out to the people that you want them to if the time comes that they need to use them.
Lovely. And all these links we will actually put onto Facebook afterwards so that you can have access to those, as well as this presentation. We've got another question here, is where do you go to have this conversation with your medical team or a legal team?
So you can start the conversation yourself, and that's what I'm hoping will happen after today's presentation, is that you'll firstly have a think to yourself about who the right person might be, what some of your values are, and maybe have a look at some of the forms if you feel comfortable. We can also help by sending out printed copies of the forms, and I think we've been talking about some of the technological issues, and it can be hard to get on a website and print a form off. So again, our National Support Service can send you out copies of the forms if it is a little bit hard or if you can't find them, so you can give them a call. So I hope that this will prompt you to have some of those conversations, maybe start thinking about the forms, and then reach out to your treating team, your healthcare professionals, your Medicare professional, your medical professionals, to let them know what you're thinking and what you're thinking about documenting. But I also want to make it very clear that you don't need to have a lawyer or a solicitor to have this conversation. You can do this yourself with your treating team, and that means that it's accessible to everyone. So you don't have to pay to have this process or this conversation. You can document your wishes and also appoint someone without having to go through a legal process.
There's a question here that if you don't appoint someone, who makes the decisions if you are incapacitated? And somebody else has also said, good question, if you go to hospital exceptionally unwell, little capacity to communicate, how does a doctor access the advanced care plan?
Yes. So if you don't appoint anyone, every state and territory across Australia has a hierarchy that they follow of who to contact. So the top of that hierarchy is anybody that you've appointed will come first. So you've appointed someone, they'll be the first person they contact. If you haven't appointed someone, they'll go to the next person on the hierarchy. So in most states and territories, that'll be a partner. And then it'll go down the list to children, eldest to youngest, but each state does have their own varying hierarchy that medical professionals will follow. So thinking about who is on that hierarchy and that list, is that the person that you would want them to contact? And it's always best to appoint someone yourself so that you know that you're comfortable with who's going to be making those decisions if you do come into hospital unwell and not able to do that yourself.
So do you carry your advanced care plan with you?
So the best place is, so if you share it with your local hospital, or if you upload it onto My Health Record, which you can either do yourself or you can ask a medical professional like your doctor, your GP, or someone in the hospital, they can upload it for you if you need help with doing that. That means that it's then accessible by everyone, so that you don't necessarily have to carry it with you. You can just give a copy to them and they'll upload it so everybody can access it on My Health Record, or you can send copies to your local hospital, to your GP, so that they've got that on file and they can contact that person if needed.
And there's just a little curly question here. What if you live in one state but have your treatment in another? More cross-border issues.
Yes, those poor border towns, and I do feel sorry for you. And it is a little bit more complex, but I just want you to know that if you make an appointment of a substitute decision maker in one town or in one state in Australia, it's recognised throughout Australia. So I live in Victoria. If I was to be on holidays travelling in Queensland, I've appointed my husband, that appointment will still be recognised by Queensland. And same with the Advanced Care Directive paperwork and those whole forms. There's a different form for Victoria and a different form for New South Wales, but generally all of those border towns recognise the Victorian and the New South Wales forms, so that you don't have to do two if you're having treatment in one and living in another.
So before you were talking about knowing what your values and preferences are so you can have somebody act on your behalf. How do you start thinking about what your values and preferences are?
Yeah, that is great. And it can be really hard initially to think about it. I know when I did my own advanced care directive that it was something initially that I struggled with. You know, when somebody asks you, what are your values and what would you want to happen? I think firstly, it's really important to have a conversation with yourself and for you to think about what's important to you. So some of the questions you can ask yourself are things like, what does a good day look like to me? What matters most in my life or in your life? And what would be acceptable to you in terms of thinking, talking, eating, walking? So for example, you know, thinking if I couldn't make decisions for myself, or, you know, if I was bedridden, how would that be for me? How would I cope with that? And is that something that I'm willing to live with? And for me, a life worth living is where and, you know, just answer some of these questions about what matters most to you. You can start to think about your values. There's also the My Values website, which is a specially constructed group of statements and designed to help you identify and consider, also communicate your wishes about medical treatment. So you go on and you answer particular questions, and then they'll tell you what your values are in the end. You can then document your values in an advanced care directive, and they're the forms or those structured documents that I've been talking about, which really helps you then document those values and preferences. And as I mentioned earlier, each state and territory does have their own forms, but these can be found on the Advanced Care Planning Australia website, which again is www.advancedcareplanning.org.au. Or you can call our National Support Service on 1300 208 582 to have them sent out to you. In this advanced care directive or these forms, we've spoken about that you can appoint someone to make your medical treatment decisions on your behalf. You can document your values and preferences, which gives a guide to that decision maker, but also to your treating team, your medical and healthcare professionals, that if you weren't able to communicate, that we know what's important to you and what you'd like us to be making decisions based on. But the third thing you can do in these forms is you can leave legally binding instructions about medical treatment and care that you consent to, refuse, withdraw from in your advanced care directive. So this is a legally binding document, and in that section is legally binding, and that section has to be followed by your treating doctor. And the doctor doesn't need to consult with your substitute decision maker if you've left something that's relevant in that section. So for example, you could accept, refuse or withdraw from specific treatments like CPR or ventilation. You could make a statement to say, I do not want to receive blood products under any circumstances. So it is important to consult your doctor if you decide to fill out this section. So you don't have to fill out these legally binding instructions. It might just be important for you to appoint someone to make decisions and to document your values that you'd like decisions to be made upon or considered. But if you would like to leave some specific instructions about treatment, that is possible. But remember that these things only come into effect if you can't make decisions for yourself. And it's important to consult your doctor if you do decide to fill out the section where you're leaving specific instructions around treatment that you want to withdraw or consent to, so they can provide you some advice. So make sure you involve your loved ones, your health professionals and your substitute decision makers in these conversations, and don't wait for the doctor to raise the conversation. I know I'm guilty of that, waiting for my doctor to tell me about something, but ask them, raise the conversation with them about advanced care planning, take the form to them and share your thoughts with them and ask lots of questions. That will help with the process. Oh, sorry, I've lost the sound there. I can't hear there.
Sorry, I muted myself. So
No, I think I heard that was the phrase of 2020. Sorry, you're on mute.
It was, yes.
It, aren't we?
I know, when you're talking away for a while and all of a sudden you think, oh no, I'm still muted, and everybody's going, you're muted, mute. Yeah, so yes, I'm
to all of us.
It does. No, I was just saying that that's such good advice, especially sort of, ask them. We ask all our patients to advocate for themselves, and I think something like this is really important. So yeah, and not just waiting for the doctor. So after you've decided on what your values and preferences are, is it necessary for them to be written down?
Yeah, I think we've, spoken about the forms and where you can write them down, but it's not a legal requirement that you write down your values and preferences. It is a requirement that if you want someone that's not on that hierarchy, that you do appoint them so that they can make decisions, but it's not a requirement that you write down your values and preferences. The conversations themselves are really helpful, and families and loved ones really benefit from having that discussion. But we do encourage people to write them down. And when you think about it, if you only talk to someone or some people about it, what happens if they're away, they forget, or they get a bit hazy on exactly what you say? I know when I've been in hospital with family members that it is really stressful and quite overwhelming, and it's sometimes really hard to reflect on the conversations that you had. So it can be really helpful to have a document that they can refer to and that your treating team can refer to and say, you had a conversation at this point. This is what was written down. Do you remember any of that? And, how do you think that will help this person now? So it's important to share that document and those forms, that when you do write them down, with your substitute decision maker, your loved ones, your doctor, and upload it onto My Health Record so that everybody can refer back to them. So personally, I know how challenging it can be when some of these things aren't shared or written down. So I was involved in the care of my uncle who had cancer, and he had some advanced care planning conversations with his wife, and they discussed his preference of dying at home, and they talked about it in a bit of detail between the two of them. But unfortunately, they never wrote down his wishes, and they didn't discuss it with us or anyone else in the family or with his healthcare team. So when he was at the end of his life, his wife was adamant to uphold his wishes of dying at home and really held that very close to her. But because he didn't share this conversation, he didn't have any of the necessary supports in place to really help him go through that process. So unfortunately, his death was really not peaceful and was quite traumatic for all of his loved ones and everybody that was involved. So I really want to stress how important it is to have these conversations, to write them down and to share them. And that's why we're here as your healthcare team, so that we can make your wishes come to fruition and we can support you with what it is that you want.
Great. Did have a question earlier sort of from the audience that was, can you change the person, but also can you change your mind?
Yes, of course, you can change both. You can change your mind, you can change the person. So once, I guess, focusing on the person first, if you decide to change who you appoint, you can just fill out a new form, and once it's signed and dated, that will replace the existing appointment that you've had. But yes, you can change your mind. And I think even your values and what you've documented, so what you think you are prepared to do now might change as your life changes, and it's okay to change your mind. This could happen both ways. So things that you don't want to do now become acceptable to you as your situation changes. If somebody had told me 2 years ago that I'd be locked down in my house and only able to travel 5 kilometres, I probably wouldn't have thought that it's acceptable. But in Victoria, with our 200th day of lockdown, it's actually become routine. So I never would have thought that that's something I could have adjusted to. And I guess on the other hand, things that you wanted or you thought that you wanted might change and no longer be acceptable to you. So your advanced care directive is not set in stone, and you can change it at any time. And we all know that as our life changes, our views may change. And sometimes our experiences and hearing someone else's journey or situation prompts us to rethink our own plans, which is great. And we learn from all of those experiences. So a colleague that I work with often says that we're all living, breathing documents with experiences, and as we change, so do our documents. So it's definitely a good idea to revisit them and change them, even if you have done these before. And I know for myself, as we mentioned earlier, I've got 2 young children, 2 young girls, and being a part of their life and watching them grow is very important to me now. So in my advanced care directive, I've stated that I'm willing to live with limited mobility or function as long as I can be there for them. But as my children get older, more independent, that may change for me, and I might change my own advanced care directive to reflect this if those wishes do change at that point in time.
We've had another question. Can anyone, such as a doctor, override or disagree with your advanced care plan during an admission?
Yeah, that's a great question. And I know people do worry about that as well. So I just want to say firstly that it is that filling out the forms and those, the approved forms for each state and territory make it less likely that a doctor can agree or disagree with what you've written in there, because they look and assigned and dated and have all of the legal requirements. If I was to, as a health professional, pick up something that somebody wrote on a serviette or a blank piece of paper, I might be able to question that. So filling out the forms is firstly a good step to help that, but it is sorry, I'm trying to think of the word, but no, they're not allowed to override, and it's unprofessional conduct and to override what somebody has written in their advanced care directive, and it's illegal to override what they've written in that medical treatment instructions section in particular, because that is legally binding. There are cases where it can be overridden in terms of, with emergency treatment and the ambulance arriving. If they're not sure or not aware if you have an advanced care directive, they might, if they're not aware, perform some treatment. But if you make it very clear and you have it in a clear location, like with your medication or on the fridge, then they certainly won't be providing treatment if that's what is stated there. So doctors are obliged to follow the instructions that you leave in your advanced care directive.
So you've said before, but it's always good to reiterate, where can we go to get more information or support?
Yes, great. I might actually just put up a slide so that you can see it as well as just hearing my voice, because you're probably sick of my voice at this point in time too.
Not at all.
So I'll just share that as well. So that information is there, but the Advanced Care Planning Australia website, which is www.advancedcareplanning.org.au, has all of the forms. And we've also got our free national support service, which is available from 9 a.m. till 5 p.m. Monday to Friday. We take calls from patients, from their families, from loved ones, so from health professionals, so anyone can call and no question is too big or too small. We can help you with sending out the forms or with getting started with the process and talking you through that. The calls are not time limited, so we have people that we spend an hour and a half with if that's what they need and want, and we can continue to call you back to help you through that process if that's something that you'd like. But that number is 1300 208 582. And we've also got a learning website with some modules and some information if you'd rather work through some content by yourself. So that's also there, and that's www.learning.advancedcareplanning.org.au. So that's just got some introduction about what advanced care planning is, and there's also specific information for substitute decision makers. So it is a big role. So if you want to know what questions you should be asking or how you can have some help to take that role on, that's also there as well.
Fabulous. And if anybody has any last minute questions they'd like to ask, or if you do have any questions that you do want to ask Helena, you can always email them through to me and I can forward them through if you think about it afterwards. But Helena, thank you so much. It's been a fabulous presentation. We've got feedback here on one of the comments. Great presentation today, really informative and thought-provoking. So we just thank you so much for your time and such a
Wonderful.
yeah, very appreciative.
Wonderful.
Hope you have a fabulous weekend.
Thank you. It's been great to be able to speak to you all, and yeah, the conversation doesn't have to stop here. So give us a call if you do have any other questions or anything that you need help with. Always here to help.
Wonderful. Thanks so much, everybody. And we're hoping that we might be able to do the Facebook Fridays once a month. So if there's any topics that you'd love to have, then please forward them through to us and we will endeavour to cover them. So have a lovely weekend, everybody. Stay safe, stay well, and we'll see you soon. Bye-bye.
Bye.